What is Legionnaire's disease and how do you catch it? Legionnaire's disease is a serious type of pneumonia, which means it's a lung infection that causes inflammation. It's caused by a bacterium called Legionella. Most people get Legionnaire's disease by breathing in the bacteria from water or soil. Older adults, smokers, and people with weak immune systems are more likely to get sick from it. The Legionella bacteria can also cause a milder illness called Pontiac fever, which feels like the flu and usually goes away on its own. If Legionnaire's disease isn't treated, it can be deadly. Antibiotics can usually cure it, but some people may still have health problems even after treatment. What are the symptoms of Legionnaire's disease? Legionnaire's disease usually starts 2 to 10 days after you come into contact with Legionella bacteria. At first, you might get a headache, muscle aches, and a fever that can be as high as 104 dec 40 deg C. By the second or third day, you could also have a cough, sometimes with mucus or blood, shortness of breath, chest pain, stomach issues like nausea, vomiting, and diarrhea, and even confusion or other mental changes. While Legionnaire's disease mainly affects the lungs, it can sometimes cause infections in wounds or other parts of the body, including the heart. There's also a milder version called Pontiac fever. It causes fever, chills, headache, and muscle aches, but it doesn't affect your lungs and usually goes away on its own in 2 to 5 days. What are the causes of Legionnaire's disease? Legionnaire's disease is mostly caused by a bacterium called Legionella pneumophila. These bacteria live in soil and water outdoors but rarely cause infections there. However, they can grow and spread in man-made water systems, like those in air conditioners. While it's possible to get Legionnaire's disease from the plumbing in your home, most outbreaks happen in large buildings. This is because the complex water systems in these buildings make it easier for the bacteria to grow and spread. Home and car air conditioning units don't use water for cooling, so they don't spread this disease. How does Legionnaire's disease spread? Most people get Legionnaire's disease by breathing in tiny water droplets that contain Legionella bacteria. This can happen from the spray of a shower, faucet, whirlpool, or from water in the ventilation system of a large building. Outbreaks have been linked to hot tubs and whirlpools, cooling towers and air conditioning systems, hot water tanks and heaters, decorative fountains, swimming pools, birthing pools, and drinking water. Besides breathing in water droplets, you can also get the infection through aspiration, which happens when liquids accidentally enter your lungs because you cough or choke while drinking. If you aspirate water containing Legionella bacteria, you can develop Legionnaire's disease. Additionally, some people have contracted Legionnaire's disease after working in a garden or using contaminated potting soil. Who is at risk for Legionnaire's disease? Not everyone who comes into contact with Legionella bacteria gets sick, but some people are more likely to develop the infection. You are at higher risk if you smoke, because smoking damages your lungs and make it easier to get lung infections. Having a weakened immune system also increases your risk. This can be due to HIV/AIDS or certain medications, like corticosteroids or drugs to prevent organ rejection after a transplant. Additionally, chronic lung diseases or other serious conditions, such as emphysema, diabetes, kidney disease, or cancer, make you more susceptible. Age is another factor, as those who are 50 years or older are at greater risk. Legionnaire's disease can also be a significant problem in hospitals and nursing homes, where germs can spread easily, and people are more vulnerable to infections. What are the complications of Legionnaire's disease? Legionnaire's disease can lead to several serious complications. Respiratory failure can occur when the lungs can't supply enough oxygen to the body or remove enough carbon dioxide from the blood. Septic shock can happen when a severe drop in blood pressure reduces blood flow to vital organs like the kidneys and brain. This forces the heart to work harder, but it eventually weakens and reduces blood flow even more. Acute kidney failure is another complication, where the kidneys suddenly lose their ability to filter waste from the blood, leading to dangerous levels of fluid and waste in the body. If Legionnaire's disease isn't treated quickly, it can be fatal. How can Legionnaire's disease outbreaks be prevented? And what can you do to lower your personal risk? Preventing outbreaks of Legionnaire's disease is possible by implementing water management systems in buildings that monitor and clean water regularly. This helps ensure that Legionella bacteria don't grow and spread. On a personal level, avoiding smoking can also lower your risk of getting sick from Legionnaire's disease.